I'm Dr. Andy Newmark. I'm the chief veterinarian at Lollypop Farm. Dr. Janesco asked me if I wanted her to introduce me, and since we know each other about 6-7 years, I figured why should she get up here and lie and say nice things about me, so I figured I'd just do it myself. Not say nice things about myself. I was in private practice for about 12 years, and then I saw the light, and now I've been a shelter veterinarian for about 14 years, all at Lollypop Farm. We're in Rochester. Our name, in those 14 years, our name has changed 3 or 4 times already. First, we were the Humane Society of Rochester and Monroe County. Then we were the Humane Society at Lollypop Farm. Now we're Lollypop Farm, the Humane Society of Greater Rochester, and check back in 2 years, and who knows what our name will be then. Anyway, so today I'm going to talk with you about zoonotic diseases that you might encounter in the shelter. Zoonotic diseases are diseases that are contagious between people and animals, and obviously working with animals, we certainly could be exposed to all kinds of diseases and all kinds of problems. In fact, that's a perfect way to spread disease. Fortunately, my dog Daisy did not pick up any diseases from my daughter, so it worked out okay. All right, how does this work? Stephanie? Oh, well, okay. So according to the Center of Disease Control, there are about 1,400 known human pathogens, meaning germs that could cause disease in people, and 61% of those are zoonotic, meaning contagious between animals and people. I don't know what the problem is here. Okay. Help. No, I don't want you to collect your I don't know what is going on here. Okay, technical difficulties here. So that means 868 diseases are zoonotic diseases, of those 61%. So at this point in the presentation, I usually say, we're only going to talk about 582, but since it's the last seminar of the day, we'll talk about all of them. No, I'm joking. Don't worry, we won't. So why should we be concerned about zoonotic diseases? Well, there's a lot of different reasons. The most important one is illness. We could get sick from this. Some diseases are just inconvenient. Maybe you'll pick up ringworm. Some could be debilitating. You might get Lyme's disease. Some could be deadly, like rabies. So it's important to know what we're dealing with here. And who do we have to be concerned about? Admitters? Well, I'm usually not so concerned about them. Adopters, visitors to the shelter, the staff, the volunteers, you have community service workers, anyone who might be touching the animals or coming in contact with places where the animals have been. Also, and what's most important to me, even though it's not really considered zoonotic, is the other animals in the shelter that could pick up disease and consequently perhaps be taken out of the adoption pool. Why else? Well, bad PR, certainly. As shelters, we struggle with PR sometimes anyway. We're always worried about what people are thinking. We can't afford to get a bad reputation. We want people to come in and adopt animals from us. So PR is always important, and who wants to be known as a shelter where a litter of kittens were adopted by 5 people and now everyone has ringworm in their family. So who's going to adopt from them anymore? So public relations is also very important. Finally, legal reasons and the money involved with legal reasons. The AVMA Practice Liability Insurance Trust is the organization that most of us veterinarians get our malpractice insurance from. And I kind of took this from, it's more for private practice, but it can be certainly extrapolated to the shelter also. And they say that the reasons why vets get sued in zoonotic cases are where they fail to diagnose a zoonotic disease, they fail to recommend preventative measures, something even as simple as deworming that hasn't occurred. Failure to advise the clients to seek medical care in case of if they contract a zoonotic disease, and so forth. So these things can turn around and really hurt the shelter financially. No one wants to be sued, and the money involved with that, as we'll see in a little while, could be astronomical at times. Also, we have our good friend OSHA in the mix too, as far as liabilities. You know, is your shelter OSHA compliant? Are there preventative measures taken in the shelter to prevent zoonotic disease transmission to some of the workers? Do you have infection control practices? Do you have personal protective equipment, even things like gloves, goggles, disposable smocks, things like that? Have you all had, you're all shelter workers, I assume, shelter staff? Have you all had training in zoonotic diseases and what to do and how to prevent them and washing your hands and clothes to wear and things like that?
After we had an outbreak of ringworm.
Okay, after. Well, that's usually when things happen, but after is better than never, I guess, right? So here's some examples of some lawsuits that have occurred over the years. In Oklahoma in '85, a veterinary hospital volunteer was sued because he was exposed to and contracted brucellosis. In Ohio in '97, a negligence action was filed against a pet store because they got a parakeet that turned out to have psittacosis, and they weren't told that parakeets could carry psittacosis. In '86, a kennel employee died after contracting lepto at the veterinary clinic. The vet school at UC Davis in California was sued by a lepto-infected employee. And in Texas, a couple of years back, a 63-year-old man died 16 days after buying a cockatiel from PetSmart, and his daughter ended up being hospitalized for 6 weeks because the bird had psittacosis, and they both contracted it too. It's nasty stuff, these zoonotic diseases. It could cause a lot of problems and a lot of money too. The AVML, the PLIT, also says that about 3% of insurance claims that vets submit, usually from private practice, because people are suing them and they need defense, is due to zoonotic diseases or bite wounds also. Interestingly enough, only 6% of pediatricians feel comfortable talking to their patients, I guess they're called, about the risks of zoonotic disease. So a family comes into your shelter, they adopt a little kitten, they take it home. Just so happens the next week they go to their family pediatrician for the kids' checkups. They tell them they have a new kitten, and the pediatricians don't even talk about the possibility of roundworm transmission or any other diseases. So how do these diseases spread? Well, you learned about these in other presentations already, so I'm not going to spend too much time on it, but obviously direct contact from animal to person, fomites, any kind of surface, clothes, shoes, aerosol, an animal sneezes, or it's just blowing in the wind, these dry droplets, and vectors such as fleas and ticks. So why is it a problem? Why isn't it just easy to take care of and not have problems with outbreaks of zoonotic diseases? Well, we all know how much of a problem is controlling disease in the shelter. I certainly always feel that I have every finger and every toe in the dam holding back the floodgates. Animals come in, they're incubating disease. No one knows they have disease. We're seeing, they look fine, they're in the shelter for X amount of time, and all of a sudden, boom, now the cat has hair loss, and oh look, there's a ringworm. Or now the dog has diarrhea, and oh, it turns out to be salmonella or E. coli, something like that. These animals come in, they're stressed, they're parasitized, they're malnourished. They're just waiting for more disease to happen to them. Also, at least our shelter, we're taking animals from other parts of the country now, dogs through PetSmart and other affiliations we have with other shelters. Who knows what zoonotic diseases they're bringing up to us that we don't usually see up in Rochester. A study was done that showed that when a cat comes into a shelter, it increases the shedding of these pathogens over 1 million-fold at times when they're in the shelter. So they're shedding these microorganisms, bacteria, whatever else, like crazy. And certainly that could be spread around too, to you and anyone else. Many times these signs look similar. Here's a picture of a dog's hair coat, and it's very flaky. Is it just dry, flaky skin, or is it Chiletiella, like Dr. Collins talked about, walking dandruff? Yeah, right. I had to word it nicely. Well, a lot of times admitters don't tell us the truth. Maybe they just went to the vet and they diagnosed one with a zoonotic disease. So where are they going next? To home? No. to the shelter to get rid of their animal. They're not telling us what's going on, and perhaps nobody saw it when it came into the shelter. So what do we do? How can we try and control and prevent the spread of disease around the shelter and to ourselves and other people? Well, when the animals come in, they should have an intake exam. Easier said than done sometimes. I mean, how much staff is there? What's everyone doing? Everyone's always busy. Sometimes, unfortunately, these things get missed and the animals put in a cage or a run for X amount of days even before an exam is done. And obviously that just gives us time to spread around. Deworming certainly takes down at least some of the parasite burden. Flea tick control to help with that. Vaccinations, diagnostic testing. Not all shelters could do a lot of diagnostic testing. There are some shelters where when the cats come in, they do one of those toothbrush combings of the cats and test all the cats when they come in for ringworm. We don't do that. I don't know if any of your shelters do that, but some shelters do. Monitoring for signs of illness in the animals. Certainly you need someone to go around to make sure on a daily basis that nothing new is cropped up and the animals aren't suffering with something, and take care of it and try to nip it in the bud. Take those animals out of the general population. Hopefully you have an isolation room, someplace where you could treat them and monitor them that's away from the rest of them. Also make sure that only trained and only certain specific people are going in to take care of those animals, not having everyone go in and pet the animals and go to every part of the building after that. And also avoiding too much antibiotic use and just arbitrarily giving everyone antibiotics for the hell of it certainly could increase the spread of these zoonotic diseases by making some of these organisms kind of resistant. The environment is another place where we could try and squelch down the spread of zoonotic diseases. How many of you think you have good facility design? Okay then. I don't either. We are rebuilding though. We're in the middle of a $4 million reconstruction project, so hopefully we will have a good facility design and hopefully we won't have as much disease around. Is your facility easy to clean? Are the cages easy to clean? Are the work surfaces easy to clean? It makes a big difference. In our shelter now, there are cages that you have to be a contortionist to get into and clean. I can't get down to those cages and clean them. Hopefully the people who are supposed to are doing it. Also disinfecting them, same thing. Cleaning and disinfecting, as you probably know, are somewhat different. Frequent removal of animal waste. How dogs go for walks with your volunteers. Are people picking up the waste? If you have play groups, for example, we have play yards for the dogs. Is somebody going out there on a daily or 2 times a day basis and picking up the stool that's deposited there? Makes a big difference. Hand washing stations and hand sanitizers. I'll admit it, our shelter's not perfect with that either. Not every room has a sink in there. We do have hand sanitizers in every room, but also if your hands are already kind of soiled and have organic matter on it, the hand sanitizers are not going to work. How many of you have sinks in every workroom? Okay then. Oh, you do? Okay, there's somebody. Okay, good. What shelter are you from?
ASPCA in Peru.
Okay. Peru, South America? No, I'm joking. Signage, telling people what to do, telling visitors what to do about washing their hands after visiting with the animals, after petting the animals, spending time with them. Do you have separation between the animal and non-animal areas? Is your lunchroom, your break room in the middle of the parvo isolation room? Or is it separate way down and somewhere else where the animals are not going into? These things are very important in helping not to spread zoonotic diseases around, as we'll see. So this is actually, we do have some signs up at our shelter informing people what to do. We have a big, large animal part also, hence the name Lollypop Farm. Not that we have lollipops, well we do have lollipops, but so we have all kinds of farm animals too. We have horses, cows, goats, sheep, emus, ducks, geese, pigs, deer. So in Lollypop Farm, people come to hang out with the animals, or petting area we have, so it's very important that these signs are there so people know what to do. The bad news is there aren't many sinks for them to go use until they find the bathroom, which is way away from the farm area. It almost defeats the purpose. But so what else can we do to try and control zoonotic diseases? Well, education. Education for the adopters who are taking the animals, and also obviously for the staff that works there. People have to know when they adopt an animal that there's a chance of zoonotic disease. No matter what you've already done for the animal, you could worm that animal 10 times. That animal still might have some roundworms or hookworms or whatever else. People can't, I don't think people should leave the shelter with the animal thinking everything is great and they never have to worry about anything in their lives. I mean, I think that just sets you up for big problems later on. They have to know that there are potential problems that can be foreseen. So, and there are pamphlets that the Center for Disease Control has, also pamphlets from the Companion Animal Parasite Council has. Some shelters make people sign medical and zoonosis waivers, saying, I understand the risks involved when I'm adopting this kitten or puppy, for example, with worms. Veterinary visits should be encouraged. At our shelter, people get free veterinary exams in the local community, and we tell them not every disease has been taken care of in the shelter. Bring a fecal to your veterinary practice. Have the animals checked out, because we're not perfect. Close, but we're not perfect. And restrictions. For example, you know, you're going to house your reptiles right in front for the little kids to go over and be poking at and then sticking their fingers in their mouths. In our facility, we take in snakes and iguanas and lizards and whatever else, and they're not up front in the regular adoption area. They're kept in the back, and they're seen and adopted out by appointment only. They're on our website, so at least we don't have to deal with that and part of the zoonosis. Staff education. The most important thing you could do to try and prevent yourselves from picking up any zoonotic disease is washing your hands. Very, very, very important. As we go along in this presentation also, I'll also show you some of my zoonotic medical history as we go along also. So it's important, what kind of soap are you using when you wash your hands? Are you using dishwashing liquid that's sitting around, or are you using an antimicrobial soap? How are you washing your hands? Are you scrubbing everywhere in between the fingers, under the fingernails, or are you just going 1, 2, and that's the end of it? How long are you washing your hands for? Does anyone know how long you're supposed to wash your hands for? 20 seconds. Good. You all must have seen this before. And drying of your hands is very important also. Wet hands certainly help attract and keep in germs that could be zoonotic or other germs too. The picture on the left shows it was of an ICU nurse who washed the hands supposedly thoroughly and then put her hand in a bacterial culture medium to see if anything would grow. And all the yellow dots are the bacteria growing. This is after she washed her hands. The picture on the right is what experts say when you do wash your hands, even well, you're still missing spots. The red areas are the most frequently missed, the orange somewhat missed, and the yellowish are less frequently missed. So even many times, even under the best of circumstances, you're not getting your hands clean enough. Yes?
What we have in our kennel is we have signs all over. We ask for people not to put their hands in the fingers of the kitty. You know, to spread if there's a sick dog all the way down the line or something. The problem is nobody listens to it, so you continually, you know, going after it for all kinds of diseases.
Certainly. Oh yeah, it's always a big problem.
And then we have, as we learned earlier today, with the sanitizers, everybody just thinks they use that, and with the public especially, and they're good to go. And then it's for kids with, you know, their hands in their mouth. It's like very hard to control. It's almost
Right, right. You need the hand washing police around, so to speak. No, it is tough. I spend a part of my day yelling at the staff and the volunteers about washing their hands and, you know, spying on them when I'm walking around the building. But I can't be yelling at the public who comes in, the visitors, otherwise they'll fire me. But right, it's a big problem, certainly. So what else? So staff should be educated. At Lollypop, I spend time with new staff, training them, telling them about zoonotic diseases, telling them what to do to help prevent zoonotic disease and from picking up any kind of nasty problem. Personal protective equipment. Obviously, it'd be nice if we all walked around in those kind of suits, and that would certainly help prevent picking up any disease, but that's not going to happen. Our staff has to have a change of uniforms at work, because certainly, as we all know, on a daily basis, someone's going to get urinated on, pooped on, sneezed on, barfed on, coughed on, whatever diseases are around, and not only to spread those diseases that aren't zoonotic, but even the zoonotic ones are around that way too. There is a paper that is published every few years, Compendium of Veterinary Standard Precautions for Zoonotic Disease Prevention in Veterinary Personnel. It's a pretty long title. It's a pretty long paper also. And every few years they come out with this and talk about ways to help decrease the spread of zoonotic diseases with people working in animal environments, including shelters. Disease education. Well, part of it is also training the staff what to look for, what diseases are common in your area, zoonotic diseases that you have to worry about. So we'll start talking about a few gastrointestinal diseases, and you might think, well, why have I a picture of someone finger painting up there? Does anyone have a thought? I think she does. Well, in our shelter, if the stool stays in the run and the dog's dancing around, it's finger painting. So the CDC says that between 1996 and 2008, there were over 100 human GI infectious disease outbreaks related to animals in public settings. Not just 100 individual, 100 outbreaks. That's a lot. Dr. Scarlett, who's here today in the next room speaking now, actually, did a study in 2001 that 40% of cats at a central New York shelter of kittens had intestinal pathogens that are zoonotic in nature, that could spread to people. So we have diseases, we have bacterial pathogens like E. coli, Salmonella, and Campylobacter. Do our animals have these bacteria? A lot of them do. Anytime you might have an outbreak in a room of dogs where all of a sudden they all have diarrhea, it comes on quickly, then it passes after a little while. It could have been E. coli or Salmonella that was being spread around. Is it contagious to you? Yes. Fecal-oral transmission. Now, no one's sitting there and going like that, obviously, but you get it on your clothes, it's on your pants, you're wiping your pants, you didn't wash your hands before you go to eat, your fingers in your mouth. That's how it could spread. It's not just from the backyard barbecue when the potato salad is sitting out for 4 hours or anything like that. These animals have these bacteria intermittently shed them also. Somebody raise their hand, someone? So we see it in farm animals, dogs, cats, reptiles, amphibians. They're immediately infective, meaning you get sick right away. As I said, they're shed intermittently, certainly when they're stressed. What better place than the shelter for that? Fecal-oral transmission. And you see it also where there's incomplete separation between the animal and the food areas. An example of this in the Idaho Humane Society, they had a Salmonella outbreak where 10 people had to be hospitalized and more were sick because of the cats were shedding Salmonella at that time. In the Colorado Zoo in '96, 65 people were contracted Salmonella just from touching the wooden barrier at the Komodo dragon exhibit. They weren't even touching the animal, they were just hanging out and looking in there and touching the barrier there, and they picked up Salmonella from that. At a farm day camp in Minnesota in 2001, 84 human GI infections, E. coli, Campylobacter, Cryptosporidium, from this farm day camp. In 2001 in California, a 3-month-old baby got Salmonella from his father's shirt. And they found out this because apparently this guy is a biology teacher in high school, whatever, and he was walking around with a snake on his shirt. Came home, didn't change his shirt, picks up his kid, and the kid got Salmonella. And in Florida in 2005, 63 people contracted E. coli after direct contact with an animal, some of the farm animals there, or even just from the sawdust and the shavings that are around and floating around. That's how easily contagious these problems are. So here's where I work. This is Lollypop Farm. It's a great place. We love it. Let's take a look inside and see what's going on in some of the places. Well, what have we here? This is one of the back hallways, and in there is an iguana in the cage there, and look what's next to it. The cat food cart with open can of cat food. There's dry food in some of the bowls. Could anyone say salmonella? Here, the picture on the left is, I'm embarrassed to say, the clinic where I work. So that's one of our exam tables. So on the left we have some vaccines, some other needles and syringes, a microchip, a bottle of medicine of some sort. There's a bottle of alcohol. There's some dewormer there. There's a thermometer. Don't know if it was used or ready to be used. Some KY, a stapler, because I don't know what they're doing with that. Advantage. Oh yeah, and Reese's peanut butter cups and water. It's a good combination, wouldn't you say? Then on the bottom picture there, that's one of our cat adoption rooms. And in that room, there's 64 cages worth of cats. And there's a counter in the middle. And look what's on there. Someone's been eating a sandwich in there with next to the bottles of bleach, next to the open cat food, and in between all the cats with the litter boxes 2 feet, if that much, away, and you know the cats are kicking out the litter and everything like that. So, you know, sometimes you could only talk till you're blue in the face, but so at least in the clinic, once again, you know, we have a separate small refrigerator where we keep our food, so it's not mixed in. You should never keep your own food, your sandwiches, whatever you brought for lunch, in the fridges with your stool samples, urine samples, vaccines, things like that. Not only is it an OSHA violation, but it's pretty nasty, I think. But we also have a farm camp. Remember back when I mentioned that farm camp in Minnesota? So we have little kids all summer long coming. It's very popular, and the counselors take them out on the farm. They hang out with the large animals. They're in there playing with the cats and the kittens and the puppies and whatever too. I could only hope that all these kids the counselors are making these kids wash their hands. These kids, some of them are as young as like 5, 6 years old, so God knows what's going on. Here's part of our farm compound. Cow on the left isn't going to spread disease, hopefully, but you see there's a mother and her kids walking. Back there further, some goats and sheep, and there's some people in there hanging out with them. There's another part where we have more goats, and people go over and, you know, petting the goats and the little kids. Are they going in when they go back into the shelter? Are they washing their hands? Are they using the hand sanitizers? Don't know. We have the signs up. Is anyone reading the signs? Is anyone looking up there? Don't know. We also have this pavilion area where we have picnic tables and people could eat lunch there. Look what's right in back of that. We have a bunch of cows right there. And you can't see it on the left. We usually have some horses and some more corrals, paddocks over there. So there's a perfect way for, as we've seen, that you don't even need direct contact with the animals. It's just being in close proximity, and the disease is blowing over and ending up on the picnic tables. Put your sandwich there. Sandwich goes in the mouth. These animals are intimately shedding salmonella or E. coli. Big problems could happen. After I put this presentation together a couple of years ago for a different talk, coincidentally, we were having a big barbecue picnic. It was like a staff appreciation day or whatever, and they were having it over here, and the administrators were doing all the cooking and everything. I decided not to go out and partake, and people were saying to me afterwards, "Oh, Andy, how come you didn't come out and have, you know, a hot dog or whatever?" And I said, "Well, you know, I had work to do." But it's because I certainly did not want to eat over there after putting this together and realizing what could go on. Parasites, roundworms, hookworms, tapes. We won't get into that. Dr. Collins just covered that, but they are transmissible to people. It's some interesting stats. 14% of the US population is positive for roundworms. 34% of dogs are infected with GI parasites. I thought it would be even higher than that. 1 to 3 million people annually are infected with hookworms. 22% of the United States population is toxopositive. I mean, 60 million people. And most people get toxo from eating undercooked meat or unwashed vegetables, but cats can have toxo, and what happens is they deposit the eggs in the stool, and if it sits there for a couple of days, it becomes infective, and then fecal-oral transmission once again, and it can cause birth defects, abortions, stillborns in women. That's why pregnant women aren't supposed to clean a litter box. 20-something years later, my wife still uses that excuse on me, but I don't know. In fact, an interesting study just came out by researchers, I think it was at the University of Maryland, that concluded that toxoplasmosis does cause changes in the human brain, and they've equated that with those people have a 1.5 times more likelihood to attempt suicide than the average population. So 60 million people. I thought that was kind of crazy. It's serious stuff. Almost $500,000 was awarded to a family of a child who lost vision from roundworm infection from a pet store puppy. Do you want that happening at your shelter? I assume everyone worms their puppies and kittens and all your animals, but still, one worming, 2 wormings doesn't necessarily get rid of the problem. That's why adopters have to know what they're getting into when they adopt an animal. And 750 kids develop roundworm-induced blindness yearly. Roundworms like to head up to the eyes in people. The picture on the left, called creeping eruption, is due to hookworms. You find them in the soil and the grass, and the larvae get into your skin, they burrow in there, and they start squiggling around. How nice. Picture on the right is roundworm infection when it got into somebody's eye and caused blindness. This 2-week-old calf apparently was living in someone's garage. You know, some people have cars, some people have lawnmowers, so I guess some people have calves in their garages in Rochester. So our humane law enforcement investigators went out, take the calf, brought it to Lollypop. It was there for a day or two. All of a sudden it started getting real sick. It became lethargic, weak, wasn't eating, blew out with this nasty, horrendous, bloody diarrhea. Cute calf, everyone loves it, so we're trying to save the calf. We put on IV fluids, we're giving it antibiotics, we're giving all kinds of medication. A few days after that, all of a sudden 3 of the farm staff start getting sick. And they break out with intestinal disease, i.e. bad diarrhea. One worker was so bad, she got so dehydrated and was so sick, she actually ended up going to the hospital and spending a couple of days in the hospital because of it. Then, a few days after that, myself and some of the clinic staff got sick. And we had to miss days of work because of it too. And it turned out this calf had cryptosporidium. And it's very contagious, easily contagious. And unfortunately, she didn't make it. She just kept getting worse and worse, so we had to euthanize her. But here, you know, we're trying to practice good hygiene, good sanitation, and yet 6, 7 of us came down with crypto anyway. Most people get crypto from contaminated water. There was an outbreak, I think, in Old Forge in a water park a couple of summers ago. But certainly the animals should be carrying it also. So the moral of the story is obviously, wash your hands. Respiratory diseases. Bordetella, which causes kennel cough in dogs. If you're immunocompromised or taking medication that can make you immunocompromised, weaken your immune system, you can develop severe pneumonia from Bordetella that causes kennel cough. If you have a healthy immune system, it's very unlikely that would happen. Psittacosis, disease in birds. They get bad respiratory infections, ocular discharge, nasal discharge. They excrete it in their droppings also. It sits there, it dries out, it becomes aerosolized, meaning it could float up in the air. You inhale it, you could get psittacosis, or in people it's called chlamydia or chlamydophila now. They changed the name. As we saw earlier, some guy died of it, and then his daughter was hospitalized, and it is very contagious.
I'm sorry, was that only in birds, you said?
Is that contagious to cats, psittacosis?
They have their own chlamydia. It's not the same one. This is chlamydia psittaci, or chlamydophila psittaci now they call it. Cats is felis.
So
But-
you wouldn't necessarily pass it to a cat?
No, I don't think they can, but they pass it to people. The birds do. Any of you have birds at your shelter? I know you do, okay. Do you psittacosis test your birds? Okay, well, that could be a problem, because any bird could be carrying it, and you know, you're looking for a potential problem.
Can they have it and not show?
Yes, yes, they can. They don't always have to be sick to have it. They could also be shedding it intermittently. Yes.
I was gonna say, and a lot of birds can carry it and never, ever like release it till they are stressed.
Exactly. And where are they going to be stressed? At the shelter. Conjunctivitis, actually, you brought that up. One of the causes of conjunctivitis in our cats is Chlamydophila felis, and it is at times contagious to people and could cause conjunctivitis, pink eye in people, and I've had it, so I'm testament to that. Urinary and reproductive tract diseases. That's kind of the most politically correct picture I could think of to put up. One of the big ones is leptospirosis. Lepto affects dogs. They get bloody urine. They develop kidney and liver problems. And it is obviously contagious to people. And you get it from a dog, if the dog has lepto, and urinates on you, and you have an open wound or cut, or gets in a mucous membrane somehow, you could contract lepto that way too, and you'll get liver disease and feel lousy and need to be on medication. So it's a bad disease. Lepto kind of has sporadic outbreaks from time to time. In Rochester, we don't see too much lepto, but other parts of the state, it's more common. They had a big outbreak a few years back in Long Island, I know of. Do any of you see lepto? Do you know if you have lepto around? Okay. Do you see lepto? You do? Okay. Q fever is caused by a bacteria called Coxiella, and you see it in the reproductive fluids, the birthing fluids, I should say, in farm animals and in cats also. And they did a study and found 20% of the cats in California and also in Canada and along the Atlantic coast of Canada seem to have this bacteria. And interestingly enough, this bacteria can travel, when it's dried out, it could travel 11 miles in the wind. Somehow someone measured that, I don't know how. It could stay in dried sputum or dried urine for months on end and be infectious, contagious, and you could take it in and get sick with that. Usually it causes flu-like symptoms and even leads to pneumonia. Brucellosis is also a reproductive problem in large animals. Rarely, but can be contagious to people. These Q fever and brucellosis are actually what they call biosafety 3, level 3. The only thing higher is biosafety level 4, which is like Ebola. So they're pretty serious diseases there. So don't forget. Don't worry, I'm running out of family members. It's okay. Bites and scratches, and we're starting to run out of time, I guess. Any bite or scratch could lead to infection. Those of us who've worked in the shelter more than a week, we all have our war wounds. I look at people's hands first, and if I know they're working in a shelter, and if they don't have any bites and scratches, either they're brand new, they're lazy, or they're administration. I'm not saying the last two go together, but you know, draw your own conclusions on that. Anyway, don't ignore bites and scratches. Any bite and scratch could lead to infection. Contrary to popular belief, an animal's mouth is not a clean environment. It might be cleaner than your mouth, I don't want to know, but it's not clean in there. There's all kinds of germs, Pastorella being one, staph another one, anaerobic bacteria. These things could lead to pretty nasty, serious infections. Cat bites are definitely worse than dog bites. It's a puncture wound. The bacteria and other germs are deposited down deep. You can't get to it to clean it well. It's festering in there. Next thing you know, the whole area is swollen up. You might have to go to the hospital, be on IV antibiotics. Don't ignore bites and scratches. Your shelter should have some kind of protocol. If you are bit or scratched, what has to happen to the animal, which we'll talk about in a minute, but what has to happen to you? Do you all have protocols for when you're bit or scratched? All right, that's good. Most of you too young. A couple of you, okay, there's someone from a contemporary of mine. Very good. What did he think? Cat scratch fever. It's a disease of cats, mostly kittens. It's caused by a bacteria called Bartonella. And the cats then, they get it from the fleas, and then they deposit it on their toenails. You get scratched by the cat, you don't wash it off, festers as Bartonella just takes over, and next thing you know, a couple of weeks later, you have cat scratch fever. Yes? You're not going to sing for us, are you? Okay.
I wanted to ask with the bite that you were talking about, cat bite as opposed to dog bite, is that like, 'cause, you know, I always hear that a cat bite is worse. Is it because of the depth of it?
Yeah, and you can't clean it. Yeah, you know, a dog bite, you have a dog bite, you have a big rip, it's nasty, but you could clean it. You could, you know, tend to it a lot better than you can a cat bite. Yeah. At the municipal shelter in Rochester, there was a worker there who apparently got scratched, didn't clean it off, didn't do anything about it. A few weeks later, all of a sudden, this guy was in his mid-20s. He woke up one morning, his lymph nodes were out to here. He had a high fever, he felt horrible, went to the doctor. They thought he had cancer. He had to go for a lymph node biopsy, and the good news was it turned out to be just cat scratch fever. So once again, you get scratched, don't say, oh, I'll wash it off later. Do it right then and there. Put the animal back. The animal could wait a couple of minutes and then move on. Yes?
When you get bit by cats, you need to just like soak it in like warm water with antibacterial soap.
When you're bit by,
Like a cat.
yeah, soaking it certainly helps. You want to bring down the swelling. You know, first stop cursing and yelling obscenities after being bit. But yeah, the more you do, the better. If it could get into the wound. The wound closes up pretty quick. You might not be able to get to the wound. That's why you should go see, you know, a doctor right away. You shouldn't just sit around with that. Well, let's talk about rabies now. Rabies is here. Rabies is bad, obviously. It's New York State, it's endemic in New York State. Our friend on the left, obviously, is our stereotypical idea of rabies. Wild animals, sometimes before they show the furious and vicious stage, get what's called dumb rabies, where they act nice and hanging out in the middle of the day and waving hello to you. It's usually not a good sign when you see that. So New York State is this is from 2010, number 3 in the country in rabies cases, with about 500. That's both domestic and wild animals. And New York State was number 2 that year in domestic animal cases, 43 cats, 5 cattle, 1 dog, 2 horses, and a sheep. It's all around. In 2010, Albany was the leader with 49 cases. Here in Tompkins County, they had 15. And where I live in Monroe County, we had 7 cases. Almost, I didn't check for sure, but I would think almost every county has had rabies cases. In Monroe County, these are some of the things that have happened over the last decade or more. A visiting professor at SUNY Brockport died 3 months after arriving in the United States because he was bit by his puppy back in Ghana before he left. It turned out that dog had rabies, and then 3 months later, he comes down with symptoms and dies. In 2003, a 5-year-old got bit in the backyard by a rabid fox during the day, because that's when they're going to come out and act abnormal. 2007, some kids brought home a rabid baby raccoon that they found at a golf course. In 2008, A dog got into a fight with a raccoon and it wasn't rabies vaccinated, and they quarantined it in their own home, and then 2 months later it started showing signs of rabies and they had to obviously euthanize it. In 2008, the dog you saw on the first slide, her name was Daisy, she's my English Mastiff. She weighed 185 pounds. We live in typical suburban subdivision. We don't back up to the woods or anything like that. And one morning I let her out to do her business. She was old, she was 10 years old, she's arthritic. She goes hobbling out, doing her thing. All of a sudden I hear her barking and whining and crying. I look out there, she's wrestling around with something. I don't know what's going on. I'm screaming, Daisy, Daisy. She gets up, she comes running back. I haven't seen her run that fast in years. She comes in the door, and as she's coming through the back door, there's something following her. Turns out it was a fox. So I slammed the door closed. The front half of the fox is in the house. The back half is out there. There's blood flying everywhere. The dog had all these bloody wounds on the back of her legs and on her rump, and the saliva and blood coming out of the fox's mouth. My wife comes downstairs and she's like screaming, and we don't have a gun, so there's nothing to do with that. So she's holding the door. I get a broom, I'm trying to push the fox out. The fox grabs the broom and finally we get the fox out and he runs away. So you tell me, in my opinion, that fox had rabies. What fox in its right mind is going to attack a 185-pound dog and during the day and try to come into your house? So there's a case, another case, I say, of rabies in Monroe County. 2011, at the shelter, somebody brought in this kitten, a 6-week-old, 1.5-pound kitten. I think it came in as a stray. Its leg was all mangled. There were all these bite wounds up and down its leg. So we amputated the leg. We did a couple more things to it. The kitten recovered, got stronger. One of our technicians, she was a new technician at the time, adopted the kitten. And the story? Of course not, otherwise I wouldn't be telling it to you. A few months go by, she was off that day, all of a sudden she calls up and says, I don't know what's going on, the kitten attacked me, I have this bad bite wound on my leg, she's acting crazy, I never saw anything like it, I had to lock her in the room. So I'm thinking back to how this kitten looked when she came in with that mangled leg, and I said to her, Kelsey, I think you need to bring the kitten in, we got big problems here. So, fortunately for me, I left for the day, and but the other vet was still there, so she had to deal with it. And personally, I've never seen a case of rabies in the flesh, and she never did either, but she said she never saw anything like it. Euthanized the kitten, sent the head out for testing, and sure enough, the kitten had rabies. So it boggles my mind how this 1.5-pound, 6-week-old kitten survived an attack from a rabid animal, but certainly opens up my eyes to, well, what happens if someone from the public had adopted this kitten instead of the technician? What nightmare would that have brought on? So we had a meeting in the shelter, the administration, about what we're going to do. Are we going to change our policy? Bottom line is we didn't, but it's something to think about. You know, do we want to deal with, who wants to deal with this nightmare? So 3 or 4 of our staff had to go for the post-exposure injections, and the rest of us all of a sudden just ran to get our titers checked, and those who haven't had pre-exposure shots went for that, and cost the shelter a lot of money, but it needed to be done. You probably all know, for rabies, if an animal comes in and in the shelter or even before the shelter, it has to be on a 10-day bite hold. Why? To see if it shows signs of rabies, because if it doesn't show signs of rabies in that 10 days, you're safe. If it does show signs of rabies, you're potentially in trouble, and you certainly need to get treatment before it gets too late. If you get to the point where you're showing signs of rabies, it's very, very unlikely that you're going to survive. There have been 5 or 6 people who have survived after having showed sign of rabies, but it's a very low percentage of success with this kind of fairly new treatment. I think it was first used in 2005, 2006 in this girl in Wisconsin, and they put her in a medically induced coma, and they gave her all these antiviral and experimental drugs, and it worked, and they've used it over and over again, and it worked in a few more people, but most of the time it doesn't work. So you know, that's why you cannot ignore bites and scratches, because anyone potentially could, any of these animals potentially could have rabies, even if they were vaccinated. Maybe they contracted rabies before they were vaccinated. It takes a while for the rabies virus to make it to the brain. The further away you're bitten from your brain, the longer it takes. If you're bitten on the toe, it's going to take a long way to reach your head. If you're bitten, 5 minutes, okay. If you're bitten on the face, it's certainly going to reach your brain a lot quicker. So you need to act on that and not ignore those kind of things. In Massachusetts, they have a regulation called wounds of unknown origin, where if an animal comes into a shelter there and has a bite wound, they either have to be held for 6 months or euthanized. How many animals come into your shelters with bite wounds? How many animals come into your shelters that maybe have bite wounds? You don't even know it's a bite wound. It's healed, there's just a little scab there. Well, was the animal scratching at itself, or was it a bite wound? Who knows? Think about that. Think about how many, if we would do that, I'm not saying they're wrong. If we would do that, though, at least in our shelter, how many animals would be euthanized because of these bite wounds? But think back to the Nala story. So which is the right way to go with this? I don't know. I don't have the answer. Wash your hands. Don't ignore the bites and scratches. Wash your hands. Skin diseases, Dr. Collins covered, so I won't go into that. Fleas, Chilotella, ringworm. I'll mention ringworm certainly is a big pain in the neck. No pun, yes, pun intended. Typically, it looks in cats, you have the bald area, a round circular patch, but ringworm could look like anything. Sometimes it doesn't look like your typical ringworm case. A few years back, we had an investigation case. We took about 50 Siamese cats from, Persian cats from some citizen, and I'm examining each one by one. I get up to cat number 48, and I say, well, this is being filmed, so I say, oh darn, this cat has ringworm. So I had to isolate them all. I read the riot act to the staff. Don't you know, about 7, 8 of the staff, including me, got ringworm. Worse than that, maybe I should sit in the audience and listen to this. Worse than that is, unfortunately, some of the staff transmitted ringworm to some of the cats up front also. So it was a real big mess, and I was worried that the whole county was going to get ringworm now from these cats being adopted, and it's a big pain. Mange or scabies, Dr. Collins went over that. All I'll say is in people, it's a transient, dog mange is a transient infection, and it'll last about a week, and you get these little red dots all over the place, and it's very, 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 very itchy. And how do I know that? Okay then. Not much time, so we'll skip over tick-borne diseases, although we are seeing more tick-borne diseases now. When I moved up to Rochester in '95, ticks were kind of unheard of up there. And like if we'd see one tick, it was like, oh, look at this. Everyone came running to see the tick. Now we see a lot of animals coming into the shelter with ticks. And they spread nasty things like Lyme's disease, Ehrlichia. And these things certainly have made our way to parts of New York State where we haven't seen ticks before. Certainly downstate, they get an awful lot of that. Lyme's disease is pretty prevalent in the city, New York City, northern suburbs, in Long Island. Protecting your pets at home. Well, it's another summer day in Rochester. Obviously, working in the shelter all day, you're coming in contact with who knows what and everything under the sun. And you certainly could be bringing these diseases home with you. The zoonotic ones that you could bring to your family members and other animals, and other diseases also that are not contagious to people. You're a walking disease magnet. You've picked up everything and anything in the shelter. So first thing is, it's important that your animals at home are vaccinated, dogs even, including kennel cough to help prevent that. It's also that they're dewormed, that they're in good health and not stressed, because when you come home, what do your animals want to do? You smell so good to them, they're running over to you and sniffing you and licking you and rubbing on you, and certainly that's the easiest way in some of the ways that you'll transmit disease to them. So another thing to do, it's very important, when you leave your shelter, or before you leave, or when you walk in the door, before you greet your family and your animals, is change your clothes. Most of us at work, it's not a fashion show. We don't wear the best clothes when we're working. We have uniforms or whatever. Change your clothes before you greet the people and animals at home to help prevent spreading disease to them. Does anyone want to have to go to the local vet and fork over some money to treat whatever disease? No. Make sure they don't get sick. We used to take care of the animals down at the municipal shelter also, so every morning before I went to Lollypop, I'd stop at the shelter down there. And then after being down there, I changed my clothes before I got to Lollypop because they have their own disease problems down in the municipal shelter. Then I do rounds, change again for surgery, change again, change later for rounds, change before I came home. So every night I'd come home with a whole load of laundry. My wife would say, "What's all this laundry? What's going on here?" And I said, "Look, I don't care if you and the kids get sick, but I don't want our pets to get sick. So deal with it." So, as I mentioned, not only are these diseases contagious to us, but certainly they're contagious to the animals in the shelter. And the last thing you want to do is spread disease around the building. It's hard enough, at least in our shelter I'll talk about, it's hard enough for an animal to make it up for adoption. All the hoops they have to jump through, from medical, behavioral, everything else. Once they make it up for adoption, we don't want them to lose their place. We have a finite number of cages and runs to treat things like URI and kennel cough even. We don't treat, for example, ringworm. We don't usually treat mange. These animals have it tough enough, and certainly it's tough enough they could spread it between themselves and through fomites. We don't have to act like a fomite also and spread disease around the building to the other animals and spread disease and potentially not only make them sick, but take them out of the adoption pool and have them stay longer and increase the time they're at the shelter, or not even be able to keep them and unfortunately have to euthanize. So it's very important that you remember this. You are contagious. Before I go and look and examine the next animal, I'm always saying to myself, what was I just doing? What was I examining? What was going on with that animal? Did I wash my hands? Do I have snot on my scrub shirt? Was I barfed on? Whatever the thing is, I'm making sure as best I can, short of going through a decontamination chamber every minute, that I'm not spreading disease around the building. And in my opinion, that's what you all have to do too, to keep your animals there healthy and get them out the door as quick as possible. And that's the story. And I thank you for staying. I just like this cartoon. Thank you for staying. Have a nice weekend. What's left? Don't applaud, just throw money. That's what I always say.